Vancouver has always been a leader in drug policy in Canada and around the world. The 4 pillars of prevention, harm reduction, treatment, and enforcement started right here and then became the Canadian Drugs and Substances Strategy. For too many years, the ideological opposition to harm reduction has cost lives. British Columbia has been the epicenter of the overdose crisis and substance use harms for several years now. And in 2016, then Provincial Health Officer Dr. Perry Kendall declared a public health emergency. I also want to take a moment to thank him for all his leadership and his ongoing work to end this crisis. Since 2016, there have been over 9,400 deaths due to toxic illicit drugs. In 2021 alone, more than 2,200 lives were lost in this province. Thousands of families, support networks are experiencing this grief, some of whom have lost multiple loved ones. Despite the best efforts in increasing harm reduction, the crisis has worsened. The increasingly toxic illicit drug supply has exacerbated the already heartbreaking loss of life. Seulement, en Colombie-Britannique,
only in BC, there are on average 5 deaths per day. Each one of these deaths sent a vibe of devastation among his family and communities. 5 families, groups of friends, work environments and communities must, and their lives have been shattered and changed.
For far too long, this wave of loss has been the reality here in British Columbia and across the country. Last March, Minister Hajdu appointed an expert task force, co-chaired by Kwame McKenzie, Carol Hopkins, Mike Sir, and we thank them and the whole task force for their truly important recommendations. Their May and June reports called for bold action and significant policy change. Today, we take the first steps in the much-needed bold action and significant policy change. L'année dernière, comme composant additionnel à cette réponse,
as an additional component to this response, the province and Vancouver asked for an exemption with rules regulating certain substances that would allow adults in BC to be in possession of a small amount of certain illegal drugs for personal consumption and not have criminal charges.
After thoroughly reviewing this exemption request and carefully considering the public health and public safety impacts, today I'm here to announce that I will be granting British Columbia's exemption request. As of January 31st, 2023, adults 18 and over in British Columbia will no longer be subject to criminal charges for the possession of up to 2.5 grams of certain illegal drugs for personal use, and the drugs will not be confiscated. Minister Malcolmson and I want to be very clear. This is not legalization. We have not taken this decision lightly. We have been working with the province over the past months to ensure that their final application was able to meet the criteria necessary for Canada to be able to grant a province-wide Section 56 exemption to the Canadian Drug and Substances Act. This time-limited exemption is the first of its kind in Canada, and with it comes great responsibility for the health, safety, and well-being of the people in British Columbia, and a template for other jurisdictions across Canada. As part of the exemption request, the BC government is committed to a comprehensive implementation plan to ensure risk mitigation and support a full range of resources and services for people who use drugs. Aujourd'hui, l'approbation de la demande
Today,
est accompagnée
the approval
d'une lettre à la
of the
ministre de la
request
Santé mentale et des
is
Dépendants
supported
sur la
by the Minister
Colombie-Britannique sur le
of
Malcolm
Health
où
and
j'ai réitéré
Mental and Addiction of
l'importance
BC.
remplir les obligations de leur
So
application
the
et
obligations of their
notre
applications
engagement
and
à
our
faire cela
engagement
en partenariat.
to do this in
Nous
partnership.
dévoilons également
We
la
are
lettre
also
publiquement aujourd'hui.
Publicly announcing
Throughout
today.
the exemption period, our government will work with the province to analyze the data and evidence and ensure that this exemption continues to be in the best interest for the health and safety of British Columbians. Real-time adjustments will be made upon receipt and analysis of any data that indicates the need to change. We look forward to undertaking this groundbreaking work with them in partnership. The dedication, commitment, and hard work of the province, as well as the municipalities, has provided the foundation for us approving this request. While approving this request is significant, it must be seen as one additional tool to be used in the ongoing comprehensive response to the crisis. Since 2017, we have taken significant actions and made investments over $800 million to address the overdose crisis and substance use-related harms. And today, as part of our government's commitment to support access to a comprehensive range of services and supports and making quality treatment, prevention, and harm reduction services accessible across the country, I am pleased to announce that an additional $11.78 million in federal funding for 14 projects through Health Canada's Substance Use and Addictions program right here in British Columbia. By scaling up prevention, harm reduction, and treatment efforts, these projects will support people who are at risk of experiencing substance-related harms and overdose. Ce financement va permettre à des
This
projets
funding will allow
communautaires
community projects to continue to serve the people who need
We
it.
know that more needs to be done here in British Columbia and across the country, and we will continue to support all evidence-based initiatives that protect the health and safety of all Canadians. Again, I want to thank Minister Malcolmson and Premier Horgan for their leadership on this issue. And I again want to thank the City of Vancouver for pioneering innovative ways to address substance use for many years. There is much we can learn from these bold and creative efforts. Vancouver is the home to Canada's first federally approved safe consumption site, Insight, which is now one of 37 sites across the country. And in closing, I want to acknowledge the support of Chief Larkin and the Canadian Chiefs of Police, and once again, Mike Sir of the BC Chiefs of Police. As I said, no longer criminally prohibiting personal possession of small amounts of certain controlled substances is just one tool in a full range of solutions to fight the overdose crisis that we are facing. Notre gouvernement va
Our
continuer de
government
travailler
will continue to
avec
work
tous nos partenaires,
with all our
incluant
partners,
les provinces,
including the
territoires,
provinces,
partenaires
territories,
autochtones, pour renforcer
Indigenous
ces
partners
efforts.
to strengthen these
By working
efforts.
together to embrace creative, innovative, compassionate, and inclusive solutions, we will continue to work together to turn the tide of the overdose crisis, save lives, and create a brighter future for communities in the province of British Columbia and across the country. Thank you. Merci.